Hello, everyone. Welcome to the 2022-2023 Prytime Medical Insurance Meeting. This, we think, is going to be your best insurance meeting, certainly of the day, and it's probably the only one that you've had. So we feel pretty confident that we're going to get through a lot of this information in the quickest time possible. My name is Ben Hallback. I work for a company called Hub, also called Catto&Catto, and I share responsibility for making sure that what ends up in this guide is the best possible benefit at the least possible price. So if you're interacting with me or two of my colleagues, Ryan or Sachi, our job is to be an insurance nerd so that you don't have to be. How about that? We're going to go over medical, dental, vision, life insurance, disability. All of this is COBRA eligible, meaning if you leave, you can take it with you. A couple of administrative items right off the bat. Right now is open enrollment. You can take somebody on the plan. You can take somebody off of the plan. But what you pick during open enrollment sticks for 1 year unless you have one of these qualified life events. These are set by the IRS, not by us or by Emily. Marriage, divorce, birth of a baby, spousal open enrollment. Those are reasons that you can change your election in the middle of the year. But outside of these things that are listed, what you pick sticks. We are renewing with Blue Cross Blue Shield of Texas. The network that you see there is the item that you need to verify when you are seeking care. Are you in my network is the appropriate question. You've got your policy number listed there, and the plan starts over October 1st, but all your deductibles run January to December. So administratively, it starts over October 1st, but functionally, with regard to the deductibles, those all reset on January 1. So we've got three different plans: bronze, silver, gold. How are they different or similar? They all have preventive services covered at 0%. We've got a little bit of a stat sheet in a couple slides from here in your guide that are going to detail what preventive services are covered for free to you. And then let's just go down. These are all PPOs. I went up there, but now let's go down. Office visits, the PPO plan that is your base plan, that is you pay a discounted rate for staying in network. You do not have a copay. All a copay is a flat rate when you use it. On the mid plan and the buy-up plan, 40 and 80, 30 and 60 for primary care and specialist. Retail clinics, kind of the doc in a box, copays for the silver and the gold, discounted rate for the base plan. Virtual visits, all on a copay, 44 for the base, 40 for the mid, 30 for the buy-up. Those are your 24/7, 365. It's through a vendor called MD Live. Those are all included in each one of these plans. Now, your deductible is higher when you're more towards the left, at least my left. And then as you go to the middle, it's 4,000. And then on the buy-up plan is 1,500. So 6,900, 4,000, 1,500. Your deductible is what you have to satisfy or meet, typically in a hospital setting. And so that's where a lot larger bills are going to come from. Know that you guys are familiar with a lot of these terms as well. But the higher the deductible, the lower the premium. The lower the deductible, the higher the premium. Coinsurance is just the split between you and the insurance company after you meet your deductible. So the first item that I look at, honestly, is this out-of-pocket. And for just reference purposes and easier math, I always use the individual, but you double that number if you're talking about family exposure. Out-of-pocket max on the base plan is $6,900. So for covered in-network services, January to December, you're at risk for $6,900. Anything else is laid off on the insurance carrier. It's $8,550 on the mid plan. It's $6,000 on the buy-up. So that's actually the number that I look at first. That's worst case scenario. And then I go and look at the deductible. I look at copays for office visits. I look at copays for prescription drugs. Again, on the base plan, you do not have a copay. You pay the discounted rate for staying in network. On the mid plan and the buy-up plan, you do have copays, and it is different between location. CVS is not in their network. CVS and Aetna went through a $70 billion merger, and imagine that. They don't want to play in the sandbox anymore with Blue Cross. So where you get preferred and non-preferred is just location. It is geography specific. It is not medication specific. You've got copays for medications. And then for things like diagnostic lab and x-rays, you'll be in co-insurance. So you meet your deductible, and then after your deductible, you pay nothing if you're on the base plan, but your out-of-pocket maximum is $6,900, which also equals your deductible. So 6,900 equals 6,900. So you don't split after 6,900 on the base. On the middle plan, 4,000. If you've got expenses that would exceed 4,000, you're paying 30 cents on the dollar. That's what that means. And that 30 cents on the dollar keeps filling up the bucket until 4,000 plus the accumulation of that 30% equals 8,550. So this is a total number. Same kind of math applies on the buy-up. It's just a lower deductible, 1,500, then you're paying 20 cents on the dollar. And once you keep paying that 20 cents on the dollar, that bucket fills up to 1,500 plus the accumulation of those 20 cents on the dollar equals $6,000. That's how these things work. So those are the pros and cons of each one of these plans. Mentioned about CVS not being in the pharmacy. Blue Cross has had, will always have, mandatory generic policy for prescription drugs. So if there's a generic and a name brand, and you want the name brand and there's a generic available, you're going to pay the difference between those two. If there is not a generic available, you'll get the name brand. That is not new. That's always been the way that it has been with Blue Cross. Here's total cost. Here's what Prytime pays. Here's what comes out of your paycheck on a monthly and then on a per paycheck basis. We at Catto&Catto and Hub work with hundreds of employers, mostly domiciled in the state of Texas. And so we have a pretty decent bead on what folks are paying, what companies are contributing. This is way above average. This is way above average. That is a very generous employer contribution. We do not see a lot of the numbers that we see underneath the Prytime pays. So yes, there's a cost to you, but comparatively speaking, for the plans that these are, it's minimal. Public service announcement here. A hospital emergency room is the same kind of bill and service as a freestanding emergency room. The freestanding ER is just literally not inside the hospital. But if you think you're going to an urgent care or retail clinic and you actually walk into a freestanding ER, you're going to have to get generic anxiety medication to even handle that bill. So know where the closest urgent care is to your home and work. Know where the closest ER is to your home and work. This is virtual visits through MD Live. I do not think this woman is caring for sick children. I have 3 children, or at least I did when I left the house this morning. I think they're going to be there when I get home. My kids do not look like this, and I am not that calm. But apparently she is, because she's using MD Live. It's just a copay, $44, $40, or $30, and then you can speak with a doctor anytime, anywhere. Here's some things that are available to you through MD Live. It's basically good for hack, cold, sneeze kinds of things. And they're integrating, which I think is a good thing, talk therapy, licensed counselor via MD Live. Pretty cool. Here's the preventive services. That was a kind of a PR flyer. This is the listing for adults, kiddos, women, vaccination related. It's kind of a laundry list of different things that are covered for free. This is Blue Access for members. See how happy and fulfilled this woman is? It's great. You know why she is that way? I'm really glad you asked. It's because she went to bcbstx.com/member. She logged into her account. She's got an ID card. She can even text with Blue Cross if she wants to. That's why she's so happy. Principal is the new dental provider. Last year we had Guardian. Now we have Principal. We changed because we just got a screaming deal on the same level of benefit. And we did that on several different lines. So this is a new carrier. You'll want to go to principal.com to validate in or outside of the network. ID cards are going to be mailed to your home. In case you forget it, it is available online. Every mouth gets $1,500 per year. Ortho is $1,000, but if you've ever had kids in ortho, or you can have adults in ortho on this plan. You know, $1,000 is cute, but it doesn't cover the whole thing. So an example of this would be you go and you get your preventive dental cleaning, you get 2 per year, and they say you've been eating too many gummy bears, you have a cavity. Cavity's $200. 200 minus your individual deductible is $50. The balance is $150 because it is a basic service. You pay 20% or $30 of that $150 bill. Principal pays $120 or 80% of the $150 balance. And that $120 they just paid reduces that $1,500 per year. That's how that works. Total premium, Prytime, contribution, rate by month, rate by week. Same type of plan, but just a different carrier. Speaking of this, VSP is the new network underneath Principal Financial, who's the carrier. You'll still get a card in the mail, and you can get it online. And basically for these rates, $7, Prytime contributes this amount, your monthly rate, your per paycheck rate. You go in and you pay $10 to go and that's keeping the lights on for them. Then you've got a choice. Do you want frames and lenses, or do you want contact lenses? You cannot get both at the exact same time. That's what that once every means. Either frames and lenses or contacts, not both, at least that insurance pays for. So you'll pay $10, then you'll go in $130 stipend to get some cool guy, cool girl frames, 20% off the balance over that. The lenses that go inside the frames are on a copay unless you're really blind like me. I mean, I just have to shrink these things down just to fit on my face. It's pure vanity. I'm okay with it. Just doesn't look good on my Christmas card. And I've had to do this for a while. My basketball career and my vision were both the best they ever were in my life in 5th grade. I am not in 5th grade anymore, so I can't pay a copay because my vision just is not very good. But if I wanted contacts, I'd get $130. So if my contacts cost 200 minus 130, I'd be paying 70 in that transaction. A couple of flyers, just as an FYI, this is from Principal about your eyes. You actually really can tell an incredible amount of overall body health simply by getting your eyes checked. This is new, 50 grand of life insurance. We don't want you to have to use it, but if you do, we do want you to say where the proceeds of that life insurance go. That's your beneficiary. It can be anybody you want. But if you're like a real volatile relationship kind of person, don't put the Johnny done me wrong, Susie done me wrong person as your beneficiary on your basic life insurance. Pick somebody stable, somebody that you like. Everybody gets 50 grand total premium, Prytime contribution, monthly, and then what comes out of your paycheck. So pretty inexpensive. This is also some extra life insurance. These are the rates. I will go back to what I just came to because it can be kind of confusing. You choose your benefit amount in increments of 10 grand. Then you go to your age, and these are the premiums that come out of your paycheck. So that's how much it costs. This is what it is. You can get up to 100 grand. It's called guarantee issue. You have to be eligible for it. So you have to be actively working, can't be confined in a hospital or at the end stages of life. But in general, for most people, there are no medical questions asked. And if you want it, you get it, but you got to be actively working. Got some for employee, got some for your spouse and your kiddos. These amounts are tied or tethered to what you choose. So you can't choose 0 on yourself and a whole bunch of money on your spouse. But if you were thinking that thought, there is talk therapy available through MD Live, because I would not suggest you go down that path. This is more information on the voluntary life for your spouses. Disability insurance is insurance on your paycheck. Don't cost nothing. Check it out. Paid 100% by Prytime. This is not cheap, boys and girls. Short-term disability is insurance on your paycheck. If you get sick or hurt and you are past 1 day for an accident, past 8 days for a sickness, 60% of your pre-disability earnings are insured in an insurance policy. up to $2,500 a week for 13 weeks. Long-term disability is 60% of your pre-disability earnings, up to 10 grand per month, up to Social Security normal retirement age. That is difficult to say. It's also different for each person. So I'm in my early 40s and mine is, I think it's like 67 or something like that. There are some specifics if you have some questions about short-term disability and long-term disability. If you have any more questions about, well, how long would this cover if? Would I be eligible for this if? So please call us and reach out to us if you have any questions that are specific on disability. It actually gets fairly technical, and we'd love to be able to explain it. But for purposes of attention span and the fact that God bless you, if you're still watching this, we're going to keep it very general. Here's other free stuff. EAP, paid for by Prytime. Check it out. More free counseling. You're just not going to have any more problems. I mean, is it even possible with as much great counseling as you have available to you? It's through Principal. It's free to you. Travel Assist. You get a gold star if you ever remember that this is here. It's in the policy, so we got to tell you about it. If you are traveling more than 100 miles away and you would like a concierge to help coordinate getting your bags or passport issues or repatriation of remains of a funeral overseas, that's what Travel Assist is for. Don't see it used very often, but it's in there. Premium only plan just means anything that we can pass from employer to employee without taxation, we will do. Because nobody likes to pay more tax than they have to. Some flyers on Principal for EAP or Employee Assistance Program and counseling. That's the Travel Assist. Just for fun, you can cut that out. Isn't that great? Great late night reading material here, boys and girls. Here's the Medicaid CHIPS information. We are not going to cover these items for sake of time. We are going to end on page 31 of this document. Sachi Lucas is like an insurance ninja. So call her if you have any questions. If you have any compliments, you can call me directly. Totally fine by me. And if you like hanging out on hold at a big insurance carrier, we want to give you the option to do that, or you can just call Sachi. Myself, Ryan, or Sachi are available both now and throughout the year. We back up Emily and the rest of the team at Prytime to make sure that questions get answered during the middle of the year. So if you get a bill and you don't understand it, please call us. If you need help finding an in-network dentist with Principal, because that's a new carrier, please reach out to us. So it can be easy questions or it can be complicated, like I got a big old bill from a surgery and there was an ambulance involved and I'm just not sure if I owe all this. We can help with items like that too. So please let us know. Thank you for watching. Have a great day.